Now, that woman with the baby in her hands, Heather, was a congressional candidate. She had run for office in 2008 and lost. But we're having those kinds of conversations across the country. On Thursday night, for instance, I had a dinner in Kansas City with 7 people who lived in the city, and they certainly weren't as supportive of health care reform as that group in Paducah, Kentucky was. But these are the kind of discussions we're having across the country. Now, we brought in Andrew Rubin to answer some more questions we've got from people. He's the host of Sirius XM's Dr. Radio. Andrew, let's talk about some of the specific points that our town hall panelists had raised. Will health care reform provide guaranteed affordable coverage for people with pre-existing conditions like that woman was talking about with cancer or diabetes? Conditions that currently make it very, very difficult for them to get coverage. Andrew?
Ali, that's actually an easy one. The whole reason we're having this conversation and the whole reason the country's going to these town hall meetings is because we have to cover these people. There are 50 million, whatever, as you say, whatever the number is, million people don't have insurance, and they have to be able to get it. What kind of insurance they get, what levels, you heard even in that cohesive group some disagreements about what levels of insurance they should have. That's what Congress is going to have to work out. One quick point. A lot of people who have insurance don't realize how vulnerable they could be if they actually get sick. So, you know, we talk always about these 50 million uninsured Americans. We need to do something to shore up the healthcare system to make sure that people who have insurance today are protected when something goes wrong.
And that's a very good point. And, you know, trying to get the details and the specifics of something that's not very specific, and there are not a details yet. Leave it to the Daily Show to sum up the perception that Democrats have lost the early PR battle on healthcare reform.
You don't get a surcharge there until you are over $500,000. So your first 100,000 is $300,000.
You know, it's not about the details at this point. It's really about the big picture.
People need to understand there is no bill right now to be for or against.
Jon Stewart's face and put it on the face of millions of Americans who are trying to figure out if it's so important and we have to do it quickly, but we don't know exactly what's in it. Is there a profound lack of trust among Americans about Washington being able to get this right?
Well, I think there's always a lack of trust with Washington. It didn't start with health care, but certainly there's a huge lack of trust. It's 16% of our economy. People, you know, before this election, all we heard in the news was Medicare was going broke. How are we going to pay for Medicare for the long term? And the government didn't have a plan. So now we have, you know, 5 bills out in Congress that are coming out, and it transforms the entire healthcare industry, and there's no detail. There's snippets of details, and then you hear something, and then something else comes out, and then we have not done a good job explaining what we're going to accomplish.
But that's an important point, just to know that there's a lot going on out there. There are a bunch of different proposals, so there may be some reason why there's no detail, but the questions I'm getting out on the road really have to do with accessibility. They've got to do with choice, options of who your doctors are. But certainly the biggest one that I've faced on the road is how do we pay for all of this? Again, a question from Charles in Missouri. Listen to this.
Well, I would like to know that in an economy and system of rising deficits, how can we afford to pay for this new health care reform that's, while it would be nice, is going to add a big burden to the taxpayer?
And the question, I guess, Andrew, is it possible? Is it possible to provide health coverage for all or most Americans without that just raising taxes on the wealthiest Americans? Andrew?
Well, on this one, the good news is it's actually pretty simple. There are only 2 ways to do this. You either raise taxes, which I think Congress has come out and the president has come out and said we don't want to do that. And the second is to cut costs. And the good news on the cost side is there are lots of areas where we can cut costs in the system. And again, the devil's going to be in the details. It doesn't mean you have to cut service to cut costs, but I work in this business. There's plenty of room for cost cutting.
All right. More information from you coming up. Don't go away, Andrew Rubin. For comprehensive coverage of town halls and the healthcare debate, you can check out cnn.com/healthcare. Senior citizens at town halls across the country, wow, they're mad. They're asking a lot of questions. They have a lot of concerns about what's going to happen to their Medicare. How will it affect their coverage? It is make or break month for healthcare reform, and Ali is with us right now from Kansas City, Missouri. He's been driving all over the U.S. this week on the CNN Express, talking to people just like you to get America's pulse on healthcare reform. We're responding to your concerns. We're answering your questions. No outrage, no yelling, no screaming, just information. Andrew Rubin is host of SiriusXM's Dr. Radio, and David Sertner is the legislative director for the AARP. I want to start with you first, David, and talk a little bit about what the president had said earlier this week about the AARP's position on health reform as it stands.
Another myth that we've been hearing about is this notion that somehow we're going to be cutting your Medicare benefits. We are not. The AARP would not be endorsing a bill if it was undermining Medicare. Okay, so I just want seniors to be clear about this.
Now, David, shortly after that, Tom Nelson, the chief operating officer, set the record straight and said that you had not endorsed any particular plan. What will it take to get a blanket endorsement of health care reform, any of these plans, from the AARP? What is it that you'd like?
Well, first, let me just go back and say we do agree with what the president said, which was AARP would not support any plan that would undermine Medicare or cut Medicare benefits. So in that regard, we agree with what the president had to say. This is obviously a large bill. There are many pieces of it. We are looking for a bill that basically is good for our Medicare population as well as our pre-Medicare population. For our Medicare population in particular, we're looking to make sure that there are no cuts in benefits, that people can retain access to their doctors, that we can do something to address the coverage gap, or the sometimes known as a donut hole in the Part D prescription drug benefits, that we can hold down costs in the Medicare program, and that we can make changes to help remove some of the waste from the Medicare program. So some of those things are the key pieces we're looking at in this health care reform bill for the Medicare population. And of course, primarily among those is making sure there are no benefit cuts and that we're not harming the Medicare program.
Andrew, we were just listening to a discussion about prescriptions and medication. I was at the Missouri State Fair, and I spoke to somebody named Christine who had a question about research into prescription drugs under these proposals. Listen to this.
My question is, as a science teacher, I know the importance of research in the development of new drugs and medications, and with government involvement in healthcare, I just am curious about the incentive for private industry, pharmaceutical industries, to continue the development of new drugs and medications.
Andrew, is there anything in the proposals that you've heard that would not be an incentive to create new drugs? Does Christine have something to be worried about?
You know, it's a great question. It's not just drugs. It's technology, medical technology. No, there's actually nothing in the bills right now. In fact, the president's come out pretty much said, many times, the government's not taking over health care. They're just trying to reform health care and make sure people have access to it. There's no question that, the drug industry has a public relations problem. They make money, but they also create incredible new drugs, most of them in this country. So we're going to have to, tackle what gets, how this is going to get solved in terms of this PR battle and making sure new drugs come to market. But there's nothing in these bills that's going to stop that from happening.
Let's take a listen here to this iReport about the public option.
We need a public option. It's the only thing that's going to keep the cost of health care down. For those of you that do have insurance, the public option will give you a better premium, no deductibles, no co-pays. They will be in competition with a company that's not for profit, and they will need to bring premium prices down. Everyone will save.
What do you think, Andrew?
Well, listen, everybody wants healthcare reform. So, you have to understand that we're going to have healthcare reform, and there's going to be government intervention in terms of making sure whether it be a private plan or a public plan provides health insurance for everybody in this country. Again, the details haven't really been worked out yet, so that you can't figure out the cost and what's going to get covered. But everybody wants to do that.
Here's the problem with the details, though. What people are hearing is we've got to do this quickly. This is a make or break month, but we don't really know all of the details on some of the proposals yet. And I think that's what frustrates people, because we want to know specifically, okay, here's my situation. What does it mean for me? And I don't see that flow chart anywhere that's telling us what it's going to mean for me depending on what my situation is. Is that part of the problem here?
That is 100% of the problem, and I love that you teed it up with this is a make or break month for healthcare. Well, let me give you a little secret. It's the first of many make or break months in healthcare, and we're going to have a lot more of them. And what we know now, and it's very limited what we know now, is that the health bills in Congress are going to give people insurance. Beyond that, what's it going to cost, where the benefit level is going to be, that's still open for discussion, and the Senate Finance Committee is still working out those details. But we don't know yet, and we will know soon.
All right, David Sertner from the AARP, thank you so much for joining us from Washington. And Andrew Rubin, SiriusXM Dr. Radio, host of that program, thank you so much. All right, where do you want to be, and how are you